Can sickle cell disease be cured? Bone marrow transplantation is currently the only known cure for sickle cell disease. It involves replacing the abnormal stem cells residing in bone marrow with healthy cells from an eligible brother or sister. This procedure is also sometimes called a stem cell transplant. Stem cell transplants are generally only considered in children with sickle cell disease who have severe symptoms that have not responded to other treatments. So, if your child is having really severe complications, then they'll be considered. For stem cell transplant, stem cells from a healthy donor are given through a drip into a vein. These cells then start to produce healthy red blood cells to replace the sickle cells. A stem cell transplant is an intensive treatment that carries out a number of risks. Bone marrow is a sponge-like tissue within the bones that functions as a factory and produces all the blood cells for the body. Its stem cells produce red cells, platelets, and white cells. People with sickle cell disease have bone marrow stems that produce abnormal red cells which contain defective sickle hemoglobin. To create space in the bone marrow for the healthy stem cells, a child with sickle cell disease is treated with chemotherapy to eliminate his or her own unhealthy bone marrow. Then he or she receives healthy bone marrow cells donated by a brother or sister through a vein, similar to a blood transfusion. Surgery is usually not involved. How does a brother or sister donate healthy bone marrow cells? The cells of the healthy full brother or sister are usually collected through a process called a stem cell harvest. There are 3 different ways to harvest stem cells. The first and most common is peripherally, or through the veins. The donor is given a medicine to stimulate stem cell growth in the blood. Then the blood is drawn from a vein. The blood runs through a machine that collects the stem cells from the donor's blood and then puts the blood back into his or her vein. If the donor has very small veins, stem cells can instead be collected through the pelvic bone. During this kind of stem cell harvest, the donor is put to sleep by anesthesia and a small needle is placed in the pelvic bone. The bone marrow, which resembles blood, is then pulled into a regular syringe. After enough cells are collected, the needle is removed. The child awakens from anesthesia and is usually able to return home the same day. The site of the bone marrow harvest may be sore for a few days. The donor's healthy bone marrow quickly grows new cells to replace those taken during the stem cell harvest. This process of replacement is similar to what happens when adults donate blood. Is my child a candidate for a bone marrow transplant? Your child is a candidate if he or she has complications due to sickle cell disease such as stroke, frequent pain episodes, frequent chest crises, or abnormal MRI or ultrasound of the brain, and has a full brother or sister who does not have sickle cell disease and has a closely matching bone marrow. Not all brothers and sisters of a patient with sickle cell disease are full matches for bone marrow. However, a sibling who has the sickle cell trait may also donate bone marrow. What are some of the risks of bone marrow transplants? While the majority of children do well after bone marrow transplantation, there are possible risks. Once the new stem cells are injected into the bloodstream of the child with sickle cell disease, it may take several weeks for the new stem cells to grow. Your child will remain in the hospital for approximately 2 to 3 weeks while the new stem cells grow in the bone marrow. During this time, the child is at risk for infection or bleeding. Infection or bleeding may be severe and, in rare cases, may cause death. In some cases, the transplant may fail, leading to the return of sickle cell disease. Other risks are possible, and you should discuss this with your doctor in detail. My child doesn't have a full sibling. Can other family members or people in the general population donate stem cells? Currently, only full siblings whose bone marrow closely matches can donate stem cell cells for transplant in sickle cell disease. Texas Children's Hospital is conducting research so that in the future, Donors may also be siblings who share only one parent, other relatives, or other members of the public who match with your child. All right, you guys, so that's the end of the video. That's all the information that I've gathered on my own research from the doctors, because she goes to the doctors on a regular basis. So, just kidding. She goes to the doctors on a regular basis. So, I'm always getting information. And as I get all of this knowledge, I'm going to be giving it away. So, y'all keep on coming back here to this channel. Y'all keep coming back to the channel, to the Ryan Gang, period, because
she's crazy.
We got some more stuff for you guys, okay?
She's crazy.
She's crazy too, so.
She's crazy.
Don't let this crazy girl fool you, okay?
She's crazy.
Okay, Marica! Almost broke my nail. Just got my nails done. That's crazy. I keep breaking the middle one. Period. We got our nails done. She's crazy.
She's crazy.
She's crazy.
She's crazy.
You know what? Bye, y'all.